how is a lack of vaccine access and vaccine hesitancy manifested in a variety of populations in the US and in the world, and your suggestions for uptake? Ken, could you take that one first?
You're asking me to comment on something that I'm not an expert on. So I'll be the first one to agree with Nina Uche that we need to have more forums like this where there are actually action points. That's one of the things I do think that pharma could have done and should do more of, is we need to get people that are on the ground that understand why we're not penetrating with the vaccines as well as we are, and take their points to heart. This really, I think from a science standpoint, that's all I can talk about because I'm not really an expert in anything else, is we need to see if we can get vaccines which only need a single administration, that don't need refrigeration, and that are scalable massively for the world. We need to have a tiered approach to the development of vaccines for the next pandemic, knowing that mRNA vaccines can be made quicker, and they need to be get out, as I said before, to healthcare professionals highest at risk, particularly in the area where it's starting. Like if, just example, if Wuhan had gotten, blanketed with vaccines very quickly, there would have been a different kind of response, I think. I think also they need to be made cheaper. The issue of should we get other places to make vaccines? As I said, India is actually quite good at making vaccines. Then it's just not, they're just not mRNA vaccines. But I don't know that, as I said before, I don't think the mRNA vaccines are going to save the world anyway. And we need to do everything we can to get more production of these other vaccines out there to as many people as possible.
Thank you. Uche.
I guess there are a few issues I brought up earlier, but thinking about how successful federally qualified health centers have been over the last few months in terms of the rollout and vaccinating, especially people of color. They vaccinated about 60% of the people they vaccinated are people of color. And so that just, shows kind of where the resources should go, one, but two, just how important, access at a local and hyper-local level is. I mean, to me, this is such common sense, but unfortunately I felt, I think we need to get more vaccines to FQHCs. I mean, obviously that is a success because the communities know the staff there, they know the providers there is already a relationship, right? And so I think again, it's common sense, but we're seeing that it's working. So, Kaiser Family Foundation is collecting a lot of really great data around this. I recommend people following them, especially for issues around vaccine equity and just perspectives on the rollout process. I also the CDC just came out with a study that showed that really it's going to be rural communities that are going to be the most under-vaccinated if things stay the way that they are. So we really need to find a way to talk to or engage with trusted messengers in those communities. I mean, I think even the healthcare providers are having challenges reaching and connecting with patients around vaccine uptake. But I think if we don't connect with those communities, we're going to see outbreaks in those communities as we go along.
Thank you. Nina.
Yeah, I think the federally qualified health centers, my partner works in one in New York, which has a focus on LGBTQ+, and they're just a trusted partner. They serve many underserved New Yorkers. It's a great system. They didn't have as much supply as they could have taken in the beginning, and I think that was sort of unfortunate. I just also think in terms of hesitancy and access, I just think it's a tricky issue because I agree that hesitancy is not a great word, and we really also need to look at access. We had the opportunity very early on in District 1 in New York City said, if you can find a site that's 5,000 square feet, get a provider, we'll give you vaccine. And that was great. We have this federally housing, NYCHA housing, it's our public housing. We found the site, we found the provider, we were ready to go, and we just never got the vaccine. And that would have been so easy. So I just think what I'm most sad about is I think we knew already, at least in September, that vaccines were a serious possibility. We certainly knew by November that it was happening. And there's so much we could have done to hit the ground running, even with limited supply by January. It was sort of a no-brainer. And we have mobile vans, we have mobile libraries. We could come up with 100 ideas, all of which were pretty easily actionable, even with the hyper cold chain vaccines. But there was political will wasn't there to do that.